So you know that feeling like your back needs more support, like you need a big back brace wrapped all the way around you. We're going to try to find the muscles that are deep inside you that are your inner back brace. They hold you in. Your abdomen and your back muscles and your pelvic floor work together to hold things, to keep them working and working in the right order and efficiently. Don't go get a big back brace. We're going to try to find these muscles. During these exercises, you need to breathe the entire time, both in and out. I don't want you to let your big sit-up muscles kick in. Those muscles aren't bad, but they're not what we're going for on these exercises. If they kick in, it's a little too difficult. Take it back down to the more boring level. I want you to put your hands on your belly. Take a deep breath in. Breathe out. Now gently try to pull your belly button in. Keep breathing. Pull your pelvic floor up and in. Try to hold all of that. And you're still breathing. Now let your abdomen and your pelvic floor relax. You should feel a little relaxation. You should feel something maybe come back into your fingers as you're feeling your belly, or you feel it inside you, something kind of relaxes. That's your deep core. During these exercises, we're going to use those to help keep our pelvis and our low back stable. Find a place where you can lay down flat. We're going to practice getting that deep contraction and moving our feet. Put your hands on your belly and gently pull in your belly button, keeping your back flat. We're not going to let it arch up at all. You can pull in your pelvic floor a little and let it relax. This can be really hard to get if you're having a lot of pain or you're used to not using these muscles. So this may take a while. But once you feel like you can kind of hold that, you're going to pick up a foot and put it down. And I want you to be able to do that without your big muscles popping up. If you pick up your foot and you have to use your belly pushing out, that's too difficult. So hold it in. You should be able to lift up your foot, put it down, the other foot, and put it down. And also keeping your back flat. You aren't arching up to do any of that. And none of this should cause pain. So you're trying to hold this in, and every time you can kind of relax. You can hold it again. You're trying to train your body to hold in this deep abdominal brace before you move your legs. Later, this should become easy. Your brain does it automatically. But for a while, this won't happen automatically. I'll show you a progression of exercises. So after regular marching, you can try to march opposite arm and leg. This mimics walking a little bit. And you're trying to hold in your abdomen. If when you do it, you puff up your belly, that was too hard for you. You can then try picking up a foot, and then before you put it all the way down, you pick up the other foot. If you do that and you have to rock, that was too challenging. So you can get to where then you have no feet on the ground. This is a progression towards like a bicycling abdominal exercise. You can then add in arms and legs, and you could start to extend your legs out a little bit. So feel free to use these silly little rehab exercise modifications in place of your core exercises that bother your back. If they start to get easier, make them harder as you can without increasing your back pain. If you can do something and it feels good, go for it. See how you feel the next day. But maybe instead of doing V-ups or bicycles, you do these things instead. You're teaching your body the right mechanics so that someday you can do those other exercises. This isn't forever, but it can take a long time, like weeks and months to get where you want to be, but you should see progress. It's very slow in the beginning, but you will notice it. So replace those really impressive looking other exercises with these boring exercises to get where you want to go.